Hey, it's Dr. White, and I'm back at the Dr. Whiteboard still talking about dry eye and the different types of dry eye. We've talked about what your tears are like, we've talked about what kind of symptoms you can get from dryness, and just recently I also talked about having the most typical, most common type of dryness, not enough tears. So we have a quantity problem. I have too little tears. But there's also a quality problem. Your tears don't work well enough. We call that bad tears. I like that. I like it in red too. Bad tears, dysfunctional tears, tears that don't work well enough. Basically, you've got enough tears, but the tears you're making aren't working well enough. Typically what happens is the tears break up before your next blink. Your tears should remain smoothly across the front surface of the eye, the cornea, the window to the eye, for the entire time between blinks. Certainly longer than about 10 seconds. A lot of times when we have tears that don't work, we get dryness between the eyelids. That's the area where you're most likely to need the most lubrication because that's where your lids come together. We look at three things when we're looking at tear function. We look at the meibomian glands. The meibomian glands are the glands that produce the oil part of the tear. Remember that the oil sits on the outside of this tear surface and it actually prevents evaporation. I almost said premature evaporation. Sorry. It prevents evaporation. Now, if the meibomian glands look abnormal, we know that we might find the solution there. The meibomian glands sit just inside your eyelashes and they produce the normal oil in your tears. That oil should look kind of like peanut oil or vegetable oil. When it's abnormal, sometimes it looks like coconut milk, kind of white, and sometimes it actually looks as bad as toothpaste, and if we push, it kind of comes out almost like toothpaste. The second thing we look at is we look at the tear breakup time. How long do your tears remain over the front surface of the eye? When we put the dye in the front of the eye, it basically covers the entire front surface of the eye. What we're looking at, what I'm looking at as the eye doctor, is where's that first little black spot? That means that the tears are broken up, and when did it happen? If we don't see any breakup for at least 8 to 10 seconds, your tears are probably working pretty normally. But a tear breakup time of less than 8 seconds, maybe even less than 10, but at least less than 8 means that they don't work well enough. They're not keeping the front of your eye well enough lubricated. Now the last thing we talk about again is tear osmolarity. If your tears are very, very salty, even if your tear breakup time is very short, and even if you have staining, the likelihood is that you still have lots of trouble in the salt water part of your tears, even though we typically think of bad tears as being part of bad oil. So if you have a normal tear osmolarity, a short tear breakup time, and especially if we see some abnormality here, you might have tears that don't work well enough, the dysfunctional tear syndrome, which is a type of dry eye. So, we talked about not enough tears, low tear quantity. Now we have low tear quality, bad tears, and those are the two general types of dryness of dry eye. We'll come back a little later and talk about how we might treat them because we treat the two different types of dryness differently. So, this is the Dr. Whiteboard. I'm Dr. White. We'll be back again.